My name is Joseph Peretta, and I am a Master of Public Health candidate concentrating in epidemiology here at the University of New England. I completed my applied practice experience with the Rockaway Township Division of Health under my preceptor, Health Officer Brittany Bernstein. I produced two deliverables, a health data assessment and a companion resource allocation recommendations report. Ms. Bernstein explained that a community health data assessment was needed. It was later renamed a health data assessment, reflecting its sole focus on secondary data, which she had expected. This gave way to the Resource Allocation Recommendations Report, since the assessment helped identify several key disparities across the Division of Health's municipalities, including Butler Borough, Jefferson Township, Rockaway Township, and the Borough of Victory Gardens. Practicum began with collecting data from several sources, including the American Community Survey, New Jersey State Health Assessment data, the CDC's population level analysis and community estimates, the New Jersey Department of Environmental Protection's Water Watch, and FBI's Crime Data Explorer, then creating graphs to compare trends across all four municipalities. Different databases required different treatments. Some needed census tract level assessment, others were not combined within the 5-year timeframe due to small population size, and jurisdictional boundaries created mismatches in school, crime, and water data. Data sets like the U.S. Small Area Life Expectancy Estimates projects also reflected an older time frame than the rest of the assessment. Nevertheless, this was used because it was the only life expectancy estimates that were available. 6 domains were assessed as factors of overall health: demographic profile, socioeconomic indicators, social determinants of health, public safety, physical environment, and health risk behaviors, chosen because their subcategories appeared as overarching themes across other health assessments. Throughout the health data assessment, Morris County was used as a benchmark since it was identified as one of the nation's 20 healthiest counties. This health data assessment had its limitations. It relied only on secondary data sources and therefore did not include community input, nor did it include data available only at the county or national level. National Center for Health Statistics reliability standards and value suppression also restricted some municipal comparisons, particularly for mortality and communicable diseases. Nevertheless, an attempt was made to include as comprehensive a set of current reliable data as possible. Resource Allocation Recommendation Report focused on the disparities presented in the health data assessment, identifying the most significant burdens across the municipalities, explaining how these burdens may affect residents, identifying possible contributing factors, and providing evidence-based strategies for the municipality and local health department to address the issue. Healthy People 2030 served as a guiding framework for setting targets for evidence-based interventions. Cross-municipal findings underscored disparities across multiple municipalities, highlighting the severity of the health burdens affecting multiple residents. Recommendations were then addressed by municipality in order of priority, beginning with Victory Gardens, then Butler, then Rockaway. No recommendations were proposed for Jefferson individually. However, the cross-municipal health outcomes section identified several overlapping health burdens that affected Jefferson. Several key cross-municipal findings were addressed, each supported by data and peer-reviewed literature. For brevity, I will discuss only one causal chain linking the priority health issue to the proposed recommendations. However, it's to be noted that similar evidence-based approaches apply to all recommendations throughout the report. As such, in the health data assessment, cancer mortality rates were identified to be elevated across Butler, Jefferson, and Rockaway compared to Morris County's average. Colorectal and mammogram screening prevalences were also identified to be low across these municipalities, according to Healthy People 2030, with elevated levels of polyfluoroalkyl substances in the water supply, particularly in Jefferson and Rockaway. However, they did not exceed the maximum contaminant level. In turn, the report recommended educational campaigns to improve screening prevalence and the distribution of activated carbon or reverse osmosis water filters in areas with high concentrations of PFAS. In addition, elevated cardiometabolic morbidity prompted a proposed e-health model and an educational intervention promoting healthier diets while maximizing SNAP benefits. Elevated chronic respiratory disease rates prompted friable asbestos abatement and more robust vaccine surveillance, while elevated Lyme disease incidence called for recommended annual educational presentations on habitat management. In addition to cross-municipal findings, I addressed individual health needs across Victory Gardens, Butler, and Rockaway. A high prevalence of pregnancy-related hypertension in Victory Gardens prompted a recommendation for sex education at younger ages, along with coordination with local hospitals and rideshare services for low-cost screening and transportation. Additionally, low insurance coverage linked to tooth loss in Victory Gardens prompted a proposal for student financial advisor volunteers from local colleges to help residents identify suitable insurance plans. Elevated Alzheimer and Parkinson's disease mortality in Butler called for recommendations for lead abatement, including encapsulating lead-based paint in older housing and replacing soil that has high lead concentrations. And an elevated prevalence of diabetes during pregnancy in Rockaway led to recommendations for standardized screening and diagnostic protocols across the municipality. One real challenge was the practicum's fully remote nature. Asynchronous communication with my preceptor meant waiting several days for feedback, which taught me to reach out proactively and keep working on adjacent tasks rather than letting the project stall. A second challenge was the volume. Alongside the two deliverables, the semester included substantial parallel coursework, meaning a significantly greater total time investment than I had initially anticipated. Databases served as proxies for multi-sector collaborators. Because my experience with on-site individuals was limited, I used these resources alongside peer-reviewed literature to understand residents within the Rockaway Township Division of Health's jurisdiction. Together, this multi-sector data and evidence-based literature shaped the feasible, cost-effective program initiatives and educational campaigns proposed throughout the report. This experience reinforced how clinical findings can support the rigorous data work that lets public health programs come to fruition. Although my integrative learning experience is not an extension of this experience, it will certainly address multifactorial causes of health, though with a narrower cognitive impairment specific scope. Both projects require working with secondary data and peer-reviewed literature, and I will pursue interprofessional collaboration in my ILE through discussions with practitioners about cognitive decline. Ultimately, this practicum sharpened the analytical instincts I will carry into a career in clinical epidemiology. Thank you for watching.